we're often asked, how can I prevent gum disease? And in our practice, we look at the idea of prevention as being much broader than just trying to prevent, say, gum disease. We look at what the entire habit and lifestyle of a patient is in order to prevent not only the gum and bone loss around a tooth, but the loss of tooth structure in general.
I mean, there's many ways people lose tooth structure. Acidic foods, gastric reflux takes its toll on tooth structure. Toothpaste, many toothpastes are very abrasive, especially the whitening toothpaste. Patients need to be aware of that toothpaste can be really damaging to the surface of the teeth. There's patients that have problems with grinding their teeth. There's patients that don't chew like normal patients, dysfunctional chewers, and they chew and their teeth rub against each other. It's different than clenching and grinding. It's a completely different thing. And all these things need to be diagnosed and evaluated so that you can prevent problems from occurring, not just gum disease, which is also a critical thing to give patients the tools to get their teeth cleaned. And different things work for different people. We used to be in a box in dentistry. It was always brush and floss, brush and floss.
Right.
There's so many things now that are on the market that are just as effective, if not more effective, than flossing.
And we look at what affects our oral environment, and it's just not, as Joe was saying, brushing and flossing. In any profession, we find that we just can't be looking through blinders at the teeth and gums. An ever-increasing awareness of airway and sleep apnea has effect on what is happening with teeth. The struggle for air can cause grinding. It can also encourage gastric reflux, is what we're looking for. So as dentists, our job is to look at all of these issues, look at what the risk factors are. Indeed, if you have periodontal disease, we look at diet, we look at home care, we look at your genetic makeup, how is it familial in that, what kind of tissues that you have. And so you need to take a broader perspective at what are all of these issues that affect the health of the oral tissues for any particular patient.
So, and the bottom line is prevention is multifaceted. There's just many areas that we look at when we evaluate a patient's mouth.